Don't worry.
It happens.
Yeah, you can start. You can start. Start now. Start now.
Okay. Good morning once again to our numerous viewers on YouTube, on Bluebird TV, and on this platform for another session of the Speak Out. This is a program that is highlighting in our environment issues that are germane to the advancement of our profession, veterinary medicine, inside out. Today we have a very, very good topic that I'm sure is of interest to a lot of us on this call at this moment. And that's why we appreciate those of you who have joined in the last 15 minutes to honor our invitation to see this program. Like I told you, we are bringing a very big topic this morning. For those of us in the small animal veterinary business, it's something that has been an enigma to us that causes a lot of worry to a lot of veterinarians, especially those who are not very experienced about it. But the issue of parvovirus enteritis is not even a question of whether you are experienced or not, because there are several things that are incumbent upon the treatment if a dog comes down with the syndrome. So, like I said, it causes a lot of problems to vets, a lot of worries to owners, and it causes what I call a lot of economic losses, because when you have a litter of puppies, 10 of them, 8 of them, 6 of them, and they all die to parvovirus, you suffer economic loss. It causes a lot of emotional toll on the owners and the breeders. And in the clinic, my own experience is that it brings a lot of discontent, social discontent, ruins relationships and all that, because they can't simply understand why their puppies had to die. Now, succor is here for those of us who want to be more educated in this about this topic, and that is why Professor Magaji Jahun is here to talk to us about parvoviral enteritis syndrome in puppies. Well, I'll make a comment later, because I know that, well, it's a syndrome and may not actually even come as enteritis sometimes. But I know Professor Jahun will do justice to that. So who is Professor Jahun? In a nutshell, Prof is a professor of infectious diseases that graduated from ABU, Ahmadu Bello University Zaria, and has been working in small animal clinic of the veterinary teaching hospital of the university since 1993. Can you beat that? Can you just beat that? So we're having decades of experience talking to us this morning. He's the director of the Center for Biotechnology Research and Training, which is the regional center for biotechnology, northwestern part of Nigeria. It is my pleasure and privilege to introduce to you this morning Professor Magaji Jahun to talk on the topic parvovirus enteritis syndrome in puppies. Professor Jahun, the stage is yours.
Yeah, Professor Jahun crashed out.
Wow.
And then I think Nasir, you'll continue until he will crash in to start discussing the topic. Because
please, as soon as he comes in, let me know.
Yeah, so start discussing.
Yes. When we talk about parvovirus enteritis, like I said, it's a problem that every vet, is concerned with. And for me, there's a lot of misconceptions about the syndrome itself, because parvovirus does not just have the gastrointestinal components alone. Because of its
Nasir is having some issues. I think today is a long day.
Transmission sometimes.
Yes. Continue.
And then we have is it back?
Yeah, back. Yeah. No, you continue. You froze a bit. Continue.
Yeah. So it also has another form, which is a cardiac form, because it has an effect on the myocardial muscles of the heart. And sometimes you just see these puppies dying. Sometimes it has neurologic effect, even on the puppies. You see some puppies are born with neurological defects. Some puppies are born and they just die suddenly and you don't know. And it's actually Parvo, you know. So a lot of us are focused and positioned on the GI component of the disease, which can be very scary. And that is one thing I want us to clear this morning. Now, what does Parvo do? It's a virus that we have to even study the nature of the virus itself. This virus is a non-envelope virus, and making it so very hardy, you know, resistant to a lot of disinfectant, except sodium hypochlorite, you know, because of its structure. It's a virus that once it enters, it is taken in by they call it it takes in by mouth, you know, fecal oral route.
Prof is on.
Are you back?
Okay. Sorry, Dr. Nasser. We just have a Prof coming up now.
Oh, but fantastic. I can stop.
Yes.
I just wanted to
okay,
stop.
go ahead.
Let's just start now.
Yeah, continue.
Continue until he's ready. Yeah, continue until he's ready.
Okay, when it's ready. Yeah, I said fecal oral route, because the virus is passed through the phases, and then the puppy that is going to have it is going to take it by the mouth. So once it is passed through the mouth, it actually affects all the lymphoid tissues. So when it affects all the lymphoid tissues, it weakens, reduces the number of lymphocytes, and then it reduces the immunity, it is the ability of that puppy to respond to what can make it fight it. You can imagine that kind of nonsense. And then from the lymphoid tissues, it goes everywhere until it reaches the gastrointestinal tract, so to say. And in a nutshell, because Prof is going to talk about that, I'm just paraphrasing what I think will be his lecture. And then it destroys all the lymphoid tissues. It goes to the gastrointestinal tract, and to an extent that the mucosa of the gastrointestinal tract, the crypts of labicum, is also destroyed. Once it is destroyed, there's translocation of bacteria, and in which the commensals are released into the system, and that is when you start the puppy having to be bleeding with the feces and all that. Dehydration ensues because of massive diarrhea, vomiting, and then because you have the vomiting and diarrhea, there is dehydration. And you can imagine a puppy is vomiting, is having diarrhea, and is losing blood, is dehydrated, is losing nutrient. And that is why rapidly any puppy that is having parvovirus enteritis, within 2-3 days of having this extreme signs, it becomes very, very weak, because that's a consequence. And then remember, while it is having diarrhea, it is having vomiting, it's also losing electrolytes. And one of the very serious electrolytes that it could lose is potassium. Because with the loss of potassium, the muscles become to be they are weak, because potassium is needed in the exertion of muscle activities of muscle and everything. It is weak, and it's not just the skeletal muscles, even the cardiac muscles. All the muscles of the body becomes very weak when you lose potassium. And that's big. It brings a lot of conundrum, because I ask a lot of people, what kind of fluid are you using? And they say it's lactated ringers. Fantastic. Because when you lose potassium, you also lose most of and lactated is very good. But the thing is this: if peradventure you are not losing potassium, for me, I recommend Garros. But if you are losing potassium and you have to do your electrolyte panel, and then you are losing potassium in a serial manner, it is also good to also see how to even supplement potassium even while you are treating. So there's a lot of issues concerning that, but I'm going to leave the treatment for Prof. But let me talk about what I think we should know ordinarily. Because a question will arise, how do we get parvovirus, enteritis, for example? How do the puppies, get parvovirus just anyhow? I'll say, for example, Parvo is endemic in our environment. Parvo is very, very endemic in this environment. And our attitude of going to people's houses to see their puppies, while we also have puppies in our houses, is not helping matters. You have puppies in your house that are unvaccinated. And then you had somebody, a friend of yours has puppies and everything, and you also went there to see the puppies. You don't know whether they are infected because of their own environment.
Jahun is back with his
fantastic, beautiful.
Yeah, beautiful.
So Professor Jahun,
so we can continue.
We're not here. I was just playing the role of a placeholder, example. So I am going to reintroduce you so that the lecture can start properly. So Professor Balarabe Magaji Jahun is a professor of infectious diseases, and he graduated from the university. I would say one of the foremost universities, because I know where I came from. I'm not in the University area, and I've been working in the small animal clinic of the veterinary teaching hospital of the university since 1993. So, like I was saying before you came, you are going to unload decades of experience to us this morning. You are the director of the Center for Biotechnology Research and Training, which is the regional center for biotechnology in the northwestern part of Nigeria. I have the honor and privilege to introduce to our esteemed audience and very awesome people who have been very patient this morning, Professor Balarabe Magaji Jahun, to talk to us on parvovirus enteritis syndrome in puppies. You have the stage, sir.
Thank you very much, my moderator. I want to profusely apologize for the hitches that we had earlier, but I think we are ready to start. Am I audible?
Yeah, very well.
Okay, thank you so much. Let me give you a professorship. Professor Olatunji Nasser has started talking the thing. I was just listening. I forgot that I was supposed to be the presenter. I was just following, nodding my head. So maybe we should allow you to continue.
No, don't worry. There will be a time for him.
Thank you all so much. Now, having wasted all that time, I think we should go straight into it. The canine parvovirus, also referred to as Parvo, as some people, canine parvovirus 1 and 2, was first identified in the late 60s to early 70s throughout the world. It's a new disease, kind of. However, along the line, mutations happened from the original virus that they call CPV1 to CPV2. Somehow CPV2 became more virulent and started attacking everywhere all over the world. And unfortunately, many people didn't know what to do. There was a time when I think we were in vet school, it was thought that the disease was not treatable. Our own problem in this country started in the late 80s, where we started to have an outbreak of this disease from all over. Now, fortunately or unfortunately, doctors in the country started to treat the disease, and it was like we've gotten a way out. Now, the etiology of the disease, like I said earlier, is a small single-stranded DNA virus that is not enveloped and is supposed to attack rapidly dividing cells. I said this because later on when we get into discussion, we will discuss about that. The strains are CPV1 and CPV2. Now, for the CPV1, is beginning to go into the background, while CPV2 has taken over the pathogenicity and is responsible for many outbreaks around the world. There were like 2 strains from CPV2. However, the third strain, CPV2C, had A, B, and C, started to manifest around the world. Now, since the first isolation, the genetic drift resulted in A, B, and C from CPV2. The CPV2 was first seen in Italy, and then it spread all around the world. The disease, let's look at the epidemiology now, has a worldwide distribution. Earlier in the year, not in the year, I mean, when it first started in this country, around this part of the country, like in the north, we were just seeing disease during the Harmattan. And we were thinking that it was the Harmattan dust that was bringing it in. But unfortunately, as of today, we are seeing the disease throughout the year. Like, it's just like 1 or 2 months that are spared from having incidents of this disease. The transmission is from infected feces, usually. Now, the virus is supposed to be a very tough virus and can remain in the environment for almost a year. That's how tough it is. So oronasal exposure and infection occurs in poorly immunized animals through ingestion of vomitus and feces from infected animals. The virus then replicates in the oropharyngeal and mesenteric lymph nodes, the thymus, and other structures for the animals start to be getting viremic within 1 to 5 days after exposure. Now, the disease or the virus spread from dog to dog by direct or indirect contact with feces. And I am sure I heard Dr. Tunji talking about we contribute to this transmission, because I heard him talking about visiting farms, visiting houses, visiting kennels, and you pick this virus from one place to another. Wind would also aid in the distribution of this virus. The pathogenesis of the virus, like we said earlier, it starts replicating in the oropharyngeal and mesenteric lymph nodes. Next, it targets rapidly dividing cells of the intestinal epithelial crypts, the bone marrow, epithelium of the tongue, oral cavity, and the cardiac myocytes, in addition to other organs in the body. Before the widespread vaccination of dogs against CBP2, myocarditis was a common thing, and we were losing very young puppies due to myocardial infarction as a result of this disease. Now, following exposure and an incubation period that can range from 4 to 14 days, virus shedding usually precedes the onset of clinical signs of vomiting and hemorrhagic diarrhea. Now, this is very important for clinicians. The animal may not be visibly or overtly sick. It's looking apparently healthy. However, it's already shedding virus through feces and perhaps possible vomitus. The intestinal lining then becomes denuded as enterocyte turnover is disrupted, resulting in blunting of the intestinal villi, which causes clinical signs of vomiting, hemorrhagic diarrhea, among other things. Now, following exposure and incubation that can range from 4 to 14 days, well, we've seen this slide. The viral infection in the thymus results in destruction and collapse of the thymic cortex, along with destruction of the leukocyte precursor in the bone marrow. This finding results in significant leukopenia, leukocyte reduction in infected animals. The lack of immunity combined with bacteremia from translocation of the gut bacteria puts affected animals at high risk of developing septic shock, systemic inflammatory response syndrome, multi-organ failure, and death if left untreated. We'll talk a little about the clinical signs. The commonest one, or the ones that start the lethargy, that's the first one you notice. Animal is lethargic, is weak, and may not be responsive to certain stimuli. It becomes inappetent. The vomiting then starts in, and ultimately diarrhea. Now, the diarrhea can vary in appearance from soft, mucoid, liquid, and hemorrhagic. Sloughing of the intestinal mucosal lining can give a red, gelatinous appearance to the feces. Many clinicians will testify to this. With gastrointestinal fluid losses, interstitial dehydration and progresses to hypovolemic shock can occur quickly. You have dehydration and gastrointestinal discomfort. You have pallor of the mucous membranes, delayed capillary refill time, fever, or many times, depending on the time the animal is presented, you could have subnormal temperatures. Secondary infection then occurs as a result of weakened immune system. Sloughing of the epithelium would allow for bacteria and toxins to enter into the bloodstream because the lining is compromised. So blood and protein will leak into the intestines, leading to anemia, loss of protein, and endotoxins would enter into bloodstream, thereby causing endotoxemia. The diagnosis, there were earlier diagnostic tests before we move on. Hemagglutination test, hemagglutination inhibition test, electron microscopy to demonstrate the virus. Lately, we're having immunochromatography tests that are available and easy to perform. ELISA is there for a more serious scientific-based testing. The PCR is here now to take over all the diagnostic things. And with PCR, we move on to sequencing for the identification of the virus. But indeed, the most reliable test by many clinicians is the smell that you cannot miss. Many clinicians will use that as a diagnostic tool to say that, yes, it's Parvo smell. Yes, it's smelling Parvo. So it's Parvo, as it is. There are other conditions that you can confuse with the disease, coronaviruses. Parvovirus is, however, a more serious disease than other coronavirus disease and other disease causing them. Can I understand? And the rest of them could all be confused with this, but the smell and the hemorrhage will lead you towards Parvo. The cardiac form is typically easier to diagnose because symptoms are distinct and you easily lose the patient. let's quickly look at the management. This is where the bulk of our talk is going to be centered on. The management of CPE, as we all know, since there is no specific treatment for it, is targeted at replacing what you are losing. The survival or the prognosis of this disease is depending on the age of the animal and how early you are able to start treatment. Is someone talking?
No, continue.
Hello.
Continue.
Prof, you can continue.
Are you sure it's not? Where is it?
It's slightly going.
The most important supportive care is to replace fluids. Now, in fluids, when we talk about fluids, both crystalloids and colloids may be needed. Crystalloids are the first line of defense, let me not call it defense, let me say treatment that you can give to an animal, depending on what is lost. However, a time will come when you definitely need colloids for you to support what you are using. We have different types of crystalloids in circulation, as clinicians will say, or they know. The most important thing is to be able to supplement or to replace three important things through the crystalloid administration. The first one is fluid, which is the leading cause of death in animals. Dehydration, severe dehydration will cause death in no time. So the most important thing is to see that you reverse dehydration. The next one is ionic imbalances, where you have acidity or alkalinity in the body. Metabolic acidosis or alkalosis could eventually lead to the death of the patient. And that is very important for you to look at and stabilize. The last one is energy loss. Hypoglycemia, as we know, could lead to death of a patient. So the crystalloid would battle these conditions, and with aggressive use of the crystalloids, many patients are saved without having them to go through very difficult times. Other things that are necessary as support could be antiemetics. Antiemetics given will prevent further loss from vomiting, and it will assist in stabilizing the animal. Of course, broad spectrum antibiotics are indeed needed because of the frank hemorrhagic areas. It's easy to get bacterial infection. Can you still see me?
But now your slide is off.
Yes.
It has gone off.
Yeah, the slide is on now.
Okay.
It's back.
So we definitely need broad spectrum antibiotics. The choice is left for the clinicians. Everybody has his own way of using antibiotics. Some will use this, some will use this. So there is no, we cannot say, we use the one that is working for us. So I'm not going to dwell on that long. Other supports could be complex vitamins. This is necessary because of the inappetence. We need to maintain the metabolism in the body. So the enzyme systems need to be maintained. So the B complex vitamins are necessary. Other things that could be used are analgesics because of the discomfort that is resulting from the hemorrhagic nature of this disease. However, at this juncture, I want to caution us to use analgesics. Many clinicians are using non-steroidal anti-inflammatory drugs, which is usually counterproductive because it may delay healing of these wounds and would not be in the best interest of the patient. I want to reaffirm that we should all avoid oral medications at this stage of the disease. That's because whenever you are managing acute diarrheas, it's important to rest the GI. So avoiding oral medications, not even feeding, is necessary so that the gastrointestinal tract could have a relief and will act on its own to get back to function. A number of clinicians who want to give oral anti-diarrheal, which has been proven to be, I don't want to say useless, but it could even be counterproductive to the system. Some people lately have resorted to using monoclonal antibodies, immune plasma from a recovered patient. Some clinicians are urged to keep like a donor dog that has recovered from the disease, that you can use the plasma from that dog to infuse into a patient that has been shown to help a lot. There are a number of antiviral drugs around that you could use that have been shown to support recovery. Oncotic support here means giving support just like the plasma would give you support. You need to have, or you may give something that would support the integrity of the blood. And that has been shown to be quite helpful to the animal and assist or aid in rapid recovery. I just want to mention that it's good for clinicians to respond to CAVI's rule. CAVI has 20 rules that is usually given as a checklist for you whenever you are dealing with this case. You go through them and we'll be checking them out. The first one is fluid balance, oxygenation and ventilation, blood pressure and tissue perfusion, heart rate, rhythm and contractility, glycemia, blood temperature, albumin that is helping in the oncotic pressure maintenance, electrolytes, make sure that there is electrolyte stability in the system, meditation, hemoglobin and red blood cells, the GI integrity and motility be evaluated, the nutrition should be looked at, renal function, coagulation, immune status, antibiotic dose and selection, drug doses and metabolism, wound cares and bandages, pain control, nursing care, and tender loving care. All those things are important in the management of canine parvovirus enteritis in puppies. Okay. Now this is where we are going to discuss elaborately. I failed to mention this at the beginning, that I'm glad this is called a meeting. That's a meeting for us to be able to discuss within ourselves at what we do, what we expect, what we target, and results of all we've been doing. Each clinician has his own different experience through the handling of this thing. So the first thing under prevention is immunization. Now, immunization falls under different categories. We all know that God's so kind, we can immunize against this disease. When you look at literature and hear from people around the world, they are so confident that immunization works. However, in our current situation in Nigeria, many clinicians, including myself, are querying the effectivity of immunization. Many times we see this problem in immunized animals. There were times when we were thinking that, okay, probably it's the immunization that we're not doing right. Another time, we got thinking that probably the vaccines we use may not be immunogenic. There were times when we were querying whether it's even the immunization that is assisting in the spread of this disease. But let's look at it thoroughly now from the beginning. Most vaccines are developed from the CPV 2A and 2B strain. I will not mention trade names of certain vaccines for now. I want us to consider what they do first. Clinicians will tell you certain vaccines may not work as good as others. Probably later on we hear experiences from individuals, but there are certain vaccines that I have stopped using in our own clinic because we do not see good results with those vaccines. There are certain vaccines, even though expensive, are giving us what we are looking for. So the protocol or the procedure is one area that is worrying and requires concerted effort now to develop one that is working for everybody. Everybody right now is doing his own bit. So some people will start immunizing as early as 6 weeks. I have seen some that will start immunizing puppies from 4 weeks. Some will do it 2 weeks later. Some will continue 4 weeks later, a month apart, till you reach about 4 months of age. Now, the problems with all those immunizations are where you have puppy with passive immunity, very high titer of passive immunity. If you start too early, you neutralize this passive immunity through the development of active immunity, and you have neutralization. And you will just expose the puppy to the virus. If you start too late, since we are not sure when the passive immunity is going to wane, the animal or the puppy may be exposed to this virus because you've waited. So it's a kind of a double-edged sword, where you don't want to start too early and you don't want to start too late. The most important thing is to get the animal at the right time so that your active immunization will give you active immunity while the passive one went away. Now, this is the difficulty. So what we do in our own clinic is, if we have a dam that has not been immunized, the puppies from that dam or those dams will get immunization or vaccination much earlier than the one from a dam that has been taking yearly immunization. We start usually from 8 weeks in puppies that was that must have suckled a previously immune dam. We give at 12 weeks, and we give the last one at 16 weeks. Puppies from a non-immune dam, we usually start from 6 weeks. We give a month later, we give another month, we give another month. In those puppies, we can give up to 4 shots instead of 3 that we usually give on immune mothers. Now, for the dams, a bit of caution here for clinicians and breeders: not immunize pregnant dams, because it's been shown to cause abortion. Lately now, I want to tell you that one of our researchers has found out that we have the third strain, the CPV2C, that is circulating in our environment, Zaria and Kaduna State. And that is a cause for concern. That may explain why we may be immunizing and not getting protection. I told you earlier that we were querying the immunogenic nature of the vaccines, but with this new development, it may show that A and B is not protecting against C. After sequencing the viruses, the C1 is really predominating and is beginning to show that probably we may have to look at the vaccines we import, because they may not be covering our patients. This is for us to discuss later on. We're going to have to discuss this from experienced people, but I want to encourage us to do more researches, because eventually we will come up with a solution to these problems. The next thing is strict hygienic practices. We all know that the virus is hardy. It's very difficult to kill. Common disinfectants, detergents, and the rest of them are ineffective as far as this virus is concerned. And the one known to have an effect of it is the bleach, the hypochlorous acid. Now, having seen that or having known that, you know that your premises could serve as a place of exposure to susceptible animals. And as such, the importance of hygienic practices cannot be overemphasized. We should be careful how we handle patients. We should be careful how we dispose of excreta, vomiters, our thermometers, our hand gloves, all those ones. If we try very well to maintain a very strict hygienic rule, we may be able to reduce the incidence of this disease. I want to thank you all for listening and apologize further for starting late and the glitches we had earlier. Thank you very much.
But Nasir, take it up from here.
Yes.
But before then, Professor Jahun,
yes,
you are a born teacher. Let me just say this. I hope you are not going to collect political appointment one day to leave teaching. Teaching is in your blood, to be frank with you. Your presentation is superb.
I want to apologize because the glitches we had.
No, we have leaped beyond the glitches.
Dr. Ibe, leave the moderator to tell him that.
Okay, sorry. Nasir, the moderator.
Yes, let me tell him that.
Okay, fire.
Honestly. Yeah, thank you, Professor Jahun, for that very, very explicit lecture, just like Dr. Ibe was saying, on canine parvovirus enteritis. In a nutshell, you covered every aspect. All the blades were touched, and you delivered them very succinctly. I know it's going to provoke a lot of thoughts from a lot of us, and a lot of questions will be asked. I've already seen hands being raised, but let me use my privilege as the moderator to ask you one or two questions before we revert to go into the chat box and people making their comments. Meanwhile, I will enjoin people to leave their questions to on the chat box. It may be neater for us there, unless you have a compelling reason to want to talk by yourself. Now, let's start from the issue of prevention, vaccination. You have brought in all the variables here, and it's still something that a lot of us do not want to understand. And I'm talking to vets now, those of us who have formed the bulk of the audience here. You mentioned the fact of people vaccinated for 4 weeks, from 6 weeks, and also doing as well. Some people, like you said, also vaccinated pregnant people and all that. And the problem, because I was listening to the lecture sometimes last year. I think we should all mute. There's a background voice.
There's a background voice, please.
Maybe
Mute.
We should mute. Everybody should mute himself, please, unless you are ready to talk, please.
Yeah. So initially, it was thought that the MPAs, the maternally derived antibodies, will probably win by 8 weeks or whatever. But it's been found by studies now that sometimes the MDAs do not win. Sometimes 16 weeks, 20 weeks in some subject, and 24 weeks in some subject. So it becomes a problem that to vaccinate a puppy against parvovirus and the associated condition, you don't even know when to attack it. But I like the one you said. Oh, if it's coming from a dam that is not properly immunized, you probably start early, and the one that is immunized probably start late. It is not even an assurance that the MDAs has won at that time. So instead of stopping the vaccination of, and I want to ask you whether you also want to belong to this school of thought. Instead of stopping at, okay, we say we start at 8 weeks, 12 weeks, 16 weeks. Now, sometimes, based on the kind of tests you could carry out, because there are tests now that will determine whether a puppy has taken the vaccine or not, vaccine check or something. You can even vaccinate again and again until 20 weeks, until 24 weeks to achieve full vaccination. So it's a conundrum. And I don't know how to do this, whether we're able to pay along the line owners or breeders who want to probably do vaccine check to know whether the IDM or whatever has given way, and then we can say we are safe. That is number one, sir. Number two, I'm going to give the audience a lot of time to talk and ask questions. But number two, what is your opinion when it comes to treatment on early alimentation? Yes, I know you have talked about giving antiemetics because they are going to constantly, but we have found out in my hospital that when we resume alimentation early, it doesn't matter whether they vomit it or not, but because we have a protocol, we'll give them the antiemetics, wait for about 30 minutes, feed them. Yes, sometimes they vomit, but they don't vomit all, you know, and we've seen that those who resume eating early like that have better survival of the condition. Then another thing, which is my last question here, if I'm not forced to ask another one, is the question of sero monitoring of potassium levels when you are treating parvovirus enteritis, for example, and even the white blood cell count. Because I have noticed that I do serial monitoring. If I'm treating a condition of parvo and I'm doing the white cell count maybe on a daily basis or something, and it's going down, most of the time it's a recipe for failure. I mean, the dog probably will not survive because the immune system is not being stimulated for it to respond well to the treatment. And then if the potassium is getting down and you are not replacing it also, I've also found out that such puppies will also die. And then the question of over-hydration, because a lot of vets do not know how to determine the percentage dehydration status. They over-hydrate. And at the end of the day, these dogs die of pulmonary edema rather than from the parvovirus itself. Those I have noticed. But I say I will stop at this level because we have a lot of questions already in the chat box. But please, while I'm trying to aggregate those questions, will you just comment on the questions, the three questions that I've asked you? Then I will aggregate from the chat box. Thank you, sir.
Okay, sir. Thank you so much for the information. I think it's important to answer yours first before listening to others. Let me start from the bottom. Overhydration is a problem in veterinary medicine. In human medicine, they don't have that problem. Whenever they have a patient, they give him fluid, just hook him on fluid. But unfortunately, in veterinary practice, if you are not careful, just like you said, you end up drowning the animal. Whether a puppy or any animal, you can easily drown it through overhydration. That's really a factor. Now, another problem with overhydration is many times because of the problem of myelosuppression, you may end up with anemia, and if you are not careful, you will dilute the blood, and that will cause another problem. You will cause an early death of the patient. Because of the myelosuppression, you always have a problem. The virus suppresses the bone marrow. And that's why sometimes, just like you notice, you will see leukopenia. Leukopenia will be there because the marrow will not be responding to the need of producing myeloid cells to battle this problem. And like you rightly said, all these are pointing to poor prognosis and that the animal may not be able to make it if you are able to. I deliberately didn't want to include a lot of academic stuff in there because I thought we were dealing with clinicians and maybe some scientists, and probably bringing those in may just cause further confusion to our audience. But definitely, when you are trying to rehydrate, it's not that easy. First, your choice of fluid is very important. It's left for you to know which one is predominating, whether you have more vomiting than diarrhea, or whether you have more diarrhea than the vomiting. We all know that vomiting comes and then maybe give way to diarrhea. After a while, the vomiting stops and the diarrhea continues. But at the point of you having vomiting, the fluid you are going to select is going to be a fluid that will give you an acidic environment, because your body metabolic condition will be an alkalosis. In a situation where you have more diarrheic situation, then you will have to look for fluid that is alkalinizing. Most importantly, some clinicians will actually give extra doses of bicarbonate, because the body then is going to be in acidic condition and you have metabolic acidosis. So definitely choice of fluid is really very important when you are selecting, at the time you are selecting. Now to talk about feeding, whenever, that's the rule now. We're not talking of any chronic condition now. In an acute situation, you rest the GI. Resting the GI, in most cases, we're not talking of Parvo now at the moment. We're talking of gastrointestinal problems at the acute onset. Sometimes in 60 to 80% of the cases, resting the GI itself could relieve the condition. You may not have to do anything. But in a situation where you have hemorrhagic gastroenteritis or hemorrhagic enteritis, just like we see in canine parvovirus enteritis, it has been said that giving oral medications, including food, will increase GI motility, because it's body's defense that whenever there is a problem, the body will try to take care of it by itself. Why you see diarrhea or why you see vomiting in many cases is the body's attempt to get rid of obnoxious thing. It could be a poison, it could be a foreign body, it could be anything that is not needed by the body. Automatically the body will try to get rid of it, either through vomiting or through diarrhea. But in this instance, the intestinal linings are already compromised. They are not able to function. As such, whatever you give, there are some schools that say that when you administer something orally, it encourages bacterial growth, endotoxemia, and worsen the diarrhea. Because as long as the body is not able to absorb anything, it will consider whatever is inside as foreign and will not want it to stay there. As such, it will be flushed out. So I am not certain that giving something when the animal is not ready could aid or assist in cure. Probably we will discuss this further when we hear contributions from some other people. Now, the immunization. So the biggest problem with the immunization is that it keeps getting more and more expensive. And clients and maybe dog breeders may not be able to afford 6 or 7 shots of immunization we give to a puppy. We will not want to a situation where we will reach an alarming situation like in poultry immunization procedure where you keep immunizing against Newcastle disease. After each month, you administer Lasota, that kind of thing. It will be so bad for us to say that we have reached that kind of situation. And I think it's left for us to say that we even help the poultry practitioners so that we can reduce this immunization that is doing. A number of individuals, there are a number of schools of thoughts that are thinking that even vaccination is helping the problem. It's not the solution to the problem, but that is left for us for discussion. So, sir, ideally, we are supposed to be able to measure the antibody titer in all these animals. We are all doing these massive immunizations because we are not able to ascertain at which time this antibody titer is at which level, peak or the lowest. And unless we are able to ascertain the titer we have, we will have to continue with multiple immunizations just to be on the safe side to protect the animal from contracting this problem that is exotic in society and will remain so unless we come up with something serious. Do we stop for now and hear other questions? We may continue later.
Yeah. Moderator, are you still there?
Yes, I'm still here. I'm very here.
Okay.
I want to do something on well, Professor Jahun, I like your answers, and I think the one issue of early alimentation we'll have to discuss it, because for me, I've tried it several times and it has worked. But one thing I want to leave as a take home from my own side is that all puppies should not be treated the same when it comes to vaccination in the clinic.
You're right.
Yeah, you mentioned it.
Puppy, yes, has to have a unique vaccination program based on your assessment, clinical assessment, and the environment from which that puppy is coming. So that is what normally I do. I don't say because they say, oh, vaccinate 8 weeks or 6 weeks or what. No. I'm going to sit you down, and you give me, then I now design your vaccination. So we have Victor, Prof, you still comment on that. We have Victor Ugerumba. Your hand has been raised since. Maybe you are mute and ask your questions.
Yeah, he has unmuted.
I'm with you. I have basically, my name is Dr. Victor Ugerumba. I'm in Anambra State Veterinary Services Department. Thank you very much, Prof, for a good presentation. Parvo has always been an issue, and anytime it comes up, we'll get interested. My questions are about 5 questions. One is, you said you were not going to mention antibiotics. I don't know, for us to really have a take home here, it would be nice from your own experience to tell us that, okay, these antibiotics are things you use and you get good results. That's then the second question is, in administering B complex, like you said, is helpful. The parenteral route preferable, IV or IM, which one do you think is preferable? Then the third question is, what's the best fluid therapy available when you notice cases of more of stooling and vomiting at the same time, or you notice more of stooling with little or no vomiting at all? What's the best fluid therapy? The moderator said something about Darrow when he was talking earlier, which we also have absorbed. But probably you might be able to throw more light based on the available fluid therapies we have in the market. Then the fourth question is, at what point should we start feeding, assuming we decide to take off feed? Because for me, at times when I do taking off of feed, I take off feed for like 2 days, place them on that fluid therapy for that period, and I've been getting results. Though some I lose, some I get good results. So I don't know, at what point should we start feeding? Then the third question is basically on the issue of MVRI and Parvo vaccines. I raised up that issue some time ago when we discussed this matter, but I don't think it's an issue somebody looked at. And I believe that people from that angle may be listening to us here this morning. Parvo, dog business is now a good business that is taking a good chunk of our youth off the labor market, off the streets. Some of them are fully engaged in this thing, and it's becoming economically viable for them. So I think the government should also look in direction of getting to produce PPE vaccines that will also adapt to the strain of the virus within our own environment, like Prof was discussing. Thank you very much.
Round up, so that we can take other questions from people.
Yes, round up. Thank you. Do I respond? Oh, I think maybe we should respond because it may stop further questions.
Yeah, respond. Please.
Thank you very much. Thank you, Victor. We appreciate this contribution. So now the antibiotic utilization. The golden rule is that our antibiotics should be cheap and effective. So when you're selecting antibiotics, you shouldn't go for the most expensive ones. You should go for the most common and cheap ones that are working. The AMR is another thing altogether. Probably one day I will come back to talk about antimicrobial resistance for us to know. But for this case, I know many people use different antibiotics based on availability, ease of administration, safety, and the rest of those ones, concerning that this disease could give you a multiple organ failure at the end of it all. In our clinic, we use gentamicin and any of the aminoglycosides. One advantage of using some of the aminoglycosides, they are having, apart from that, you could give them parenterally. They work in the gut. They are gut-acting antibiotics. And that's precisely where the problem or the microbes are. This is where they start before they go up into the system. So we use gentamicin, sometimes we use rofloxacin in our own clinics. The B complex, I couldn't remember what you said about giving B complexes, but we all know
I talked about the route of administration. We didn't use IG or
is usually intravenous. You see, at the beginning, when you are presented with a problem, unless you are lucky that the patient is brought very early, where nearly everything is working. Most of the time you get at a stage where the animal is almost going into shock. You have the collapse of the capillaries and the rest of the stuff. So you may have to struggle maybe to get a line where you could give your fluid. And that situation is advisable to give intravenous, unless you are dealing with a situation where your B complex cannot go IV, because there are some preparations where you cannot give them intravenous, you have to give them intramuscularly or through other routes. But if you can give them intravenous, the activity is faster through whether B complex or anything that we give. I know there are some people that are recommending giving fluid subcutaneously. We cannot give orally. That's the safest one. Some are recommending the administration subcutaneously if they cannot get a vein. Now, we have to caution clinicians concerning that. What is happening is that in a situation where you have collapse of the capillaries, you're going to have subnormal temperature. When you check, the extremities are going to be cold, most probably. Blood is going to be shunted to the most important organs in the body. And as such, skin is not considered as an important organ in the body as such. So there will be very little blood reaching the integument. And with that, it will be very risky to administer fluid subcutaneously. That will just worsen your condition. It will end up pulling the blood there without getting it absorbed. So in as much as you can, you give intravenously or intraosseously if you can. You can give it through the bones. Are you with me?
Yes, continue.
Yes,
Right.
we're here. We're
So
here.
now, the fluid therapy, the fluid we give to be on the safe side, you give the fluid that will act as a buffer. No matter the situation, it will not harm the body. If you give a purely acidic fluid, it will worsen acidic condition in the body. If you give a purely alkaline fluid, it will worsen an alkalizing condition, since we are not able to ascertain the metabolic condition of the body. So we give, to be on the safe side, a kind of buffer. So many people are using lactated Ringer solution, Hartmann's solution, all those ones. They all have buffering capacity and will stabilize the system on their own. That's why many people are venturing into it. And furthermore, they usually have lactate in them that under extreme conditions, that lactate could be converted through the TCA cycle into energy, and you have a kind of energy getting to the animal or to the patient. So direct solution, whether full or half strength, could do the job.
Yeah, thank you very much.
Starting feeding, okay, in his own, he is lucky. He starts to feed pretty early, and which I consider that this is a very lucky thing. In a situation, but like the moderator said, each patient is unique in its own presentation, depending, I guess, on the age, because the older they are, the better for us to manage, because the prognosis is better with the advancing age. The younger they are, the worse the situation, where you have to walk on, you may have to spend a week trying to get this animal back to eat. You get this animal back to eat, in our own experience, when the vomiting and diarrhea start. Then you know that the villi probably may have recovered. I say may have recovered, because even when you give food orally, if the intestinal villi are not working, you will just be wasting the food. Probably there is no diarrhea, but they will have to recover their function before they could get digestion and absorption of these nutrients. So we are not going to use one rope to tie everything, and each one comes its own condition, and each one will respond according to many things. Parvo vaccine. Yes, I'm glad Chief is here. You heard that, okay, I work in Center for Biotechnology Research and Training now. Believe me, we will have to do more than what we are doing. And I am just trying to encourage entrepreneurs like Chief Ibe. Don't laugh. This is important.
I know it's important.
Developing our own vaccines with our own circulating strains in this country. Just like Victor said, if government is not doing it, then the private sector should.
What about the cost of doing this? Cost?
Not only the cost, the regulation.
No.
The regulation. You look at the law, as a matter of imperative. You look at the law guiding all those things in the country. You don't just jump into this thing without strong legislative instrument.
No, you don't. But the legislative instruments are there now for you to apply and be given permission to establish a biological producing company. You don't do it alone. You do it with us. We do the researches here. Right now, my center is into developing vaccines. Different vaccines are going to come. But of what use is it if you cannot commercialize it?
Yeah.
We need entrepreneurs so that this thing could be commercialized. Because eventually, if we don't do it, we'll have to rely on other people doing it, and then they'll come and be dumping it on us, even if they are not.
Please, can we quickly come in now here, please? You're there right now, and these people you're talking to are here right now. If you can go back to a little bit of assignment, because I'm sure they are itching to say, okay, how much do we need to rally around for your lab, for your biology technological lab, to get so quantity of vaccines, then probably they will say, okay, this is an invention. Okay, I know my uncle there and all these other big people you call who want to make more money. So all you need to do, give them a proposal and let them get running. And I think in a couple of months, we might see something. I'm just suggesting.
Only months.
Prof, can I say something? Because it's seeming as if it's been made so simplistic.
Yes.
That it's something that you can just snap our fingers, bam, and then next year we have the vaccines. I remember
that's a talk and do syndrome.
Mohammed, when she was here a few weeks ago, also said she could collaborate with the private sector and look at the issue of the Parvo viral enteritis virus, vaccines and all that. So if we have a congress of opinions from MVRI, from your biotechnology center and everything, I think we should look at how we can coalesce our aspiration and see what can be done. But I know it's something that is not going to take months, it's going to take years, because tests will have to be carried out, so many things will have to be done, even for vets to buy in. How many of us vets in Nigeria are buying the rabies vaccine being produced by VOM right now? We don't. We don't. We buy imported stuff. So I don't want.
Sorry, sir. Let me cut in, please. Most of us do. Me, I used it yesterday, and I don't see anything wrong. But the only problem most of us have with it, let me just say it now, and I said it before, and yet I don't think anything was done about it. Those stickers are not coming off. Those stickers are not coming off like the foreign vaccine stickers. If the people doing stickers or there could come in and do stickers, better stickers, maybe more people will go in. Maybe more people will go in. I'm only talking from the field.
Exactly. Quality control, quality assurance, presentation, everything has to be worked in. If it is not worked in, perhaps even the DHLP plus P-thing, if it's going to be done, it's going to suffer the same fate as the anti-rabies coming from MVRI. But that is not the question. The question is, I've gone to the chat box now and I saw, I don't want to call it interesting, but I'm just wondering why that question was asked. But I'm going to ask Prof now. And it's coming out of, I think, from Dr. Nwokolo Ukamaka Peace. She said, thank you, Prof, for this simplified lecture. My question is it appropriate to deworm and give antibiotic at 4 weeks to puppies before vaccination or at 6 weeks or 8 weeks of age? And the reason why I said it's a strange question, so to say, I don't mean to deride the person who has asked the question, is why, what are you giving antibiotic for? But I'm not a lecturer. Prof, can you take this?
We are all in this together. You see, usually, I didn't go into that. You find that CPE comes with other complications. Other diseases will be there with CPE. Many times on examination table, you see an animal passing out worms from the feces. So these conditions are there. You could have helminthosis, you could have babesiosis, you could have E. coli infection, all within this period, especially since the disease, just like canine distemper, has a depressing effect on the immunity. So other opportunities could come up. So part of the treatment will be to treat against those things. Unfortunately, it's not advisable while you are trying to stabilize the animal. In a situation where the animal is trying to make it, you don't want to compound the situation by treating for other problems that are not life-threatening. But as soon as the animal recovers, it will help in getting the animal back on its feet by eliminating these other problems that we will see. So, but like you said earlier, what is the use of giving antibiotics early? There's no use for it. We don't give antibiotics without any need. Antibiotics are given in terms of need. So when you have normal gastroenteritis, it's not advisable to give antibiotics. But when you have hemorrhagic gastroenteritis, because of the sloughing of the epithelium, you know that there is wound in an infected environment, things are going to happen. That's why you give the antibiotic just to avoid secondary bacterial infection and nothing more.
Thank you, Prof. Now, a popular question, because a lot of people would tell me, oh, last week we had about 7 Parvo viral enteritis cases, and all of them, thank God, all of them recovered. And I asked the question, how did you diagnose? Oh, they were all shitting blood. You know, he has this peculiar smell. Once I perceive that smell and I see blood, I treat. I said, maybe you were just dealing with dogs who are just not dewormed, who are not properly dewormed, and you just deworm, and then you just got blocky.
It might be ankylostomiasis. It might be ankylostomiasis.
Yes. Do we diagnose Parvo viral enteritis by smell, sir?
You see, there are diagnostic, like I said, the easiest one that most clinics are using now is the lateral flow assay, the immunochromatographic, one that will give you result almost instantaneously. Other tests are there that are not routinely done unless you are doing some researches. Let me say, we all know that most viral diarrheas are smelly. If you have the GI form of canine distemper and you see the diarrhea that's coming is going to be smelly. If you have other coronavirus diseases, once the diarrhea is there, plus whenever there is sloughing of the epithelium, you get a smelly diarrhea. So it's really difficult to just say, okay, it's Parvo. But I know that's what we do. The smell is peculiar. There is no other viral disease that gives you the kind of offense that we get in Parvo. Distemper smell is a little different. Corona smell is a little different, like that. But scientifically speaking, you have to be sure that this is the problem by conducting a test. Not just sniff your thermometer and say, yes, this is Parvo. Because many clinicians do that. After taking temperature, they sniff the thermometer and say, yes, it's Parvo. Yes, see blood stain on the thermometer, this is Parvo, and start treating immediately. We have to be scientific in nature, but like I said, people do things to solve their problems. Victor there just said that he starts feeding like 2 days after he's resumed fluid therapy and it's working for him. The moderator starts early and it's working for him. There are some conditions where you may have to take feces from a healthy puppy, a healthy immune puppy, to inoculate into a patient. This, they call it fauna, is it translocation of fauna or something? You need to stabilize the GI before it can peak and continue working. So different people do different things. And I think I like what Olatunji said, that let's not get a block thing that will say, okay, this is it, because each case comes with its own problems or different things, and we cannot have one block thing that will cover all.
Hello?
Yeah,
Yes.
continue,
Yeah.
Tunji.
Yeah, somebody asked a question. He actually asked about 3 questions, but I think 1 and 2 would have been answered, or let me just read the way the questions are. Questions are, is the monoclonal antibody practical? That is in terms of diagnosis and all that. Then he was asking for the link to get Basi check and Parvo test kits. That is a commercial one. Maybe Dr. Ibe will answer that. But for the prof, please, what are the antivirals that can be administered when managing Parvo? And how do I source them?
Well, most of the antivirals that are in use are influenza-based antivirals. They are not specific for Parvo, but they are for influenza. Flu antivirals are the ones that you use, and they give good results. There are many of them. Just like, all us small animal practitioners, most of our drugs are sourced from human pharmacies, things like that. Once you go there now, you will get some of the antivirals that are being used against influenza. They will assist. The only thing why we are not talking about, I know many of you have rich clients. Many of our clients cannot afford conventional treatment. No talk of adding very expensive drugs to the treatment. However, I know there are some that will happily maybe do that.
No,
The center.
it depends.
How does the
It
biotechnology
depends.
center?
Okay, continue.
Dr. Ege, you want to say something?
No, yeah, it depends on the exotic nature of the dog, and it depends on the ownership, and it depends on the cost of the dog. If it's a dog, so some puppies, you can sell them up to $500,000, some breed, and then they are telling you bring 100,000 or 200,000 to treat it, or it will die. I think for cost-benefit analysis.
You do that.
Yes, and treatments
For
are
the
done on
treatment
cost-benefit.
of Parvo, because for me, I'm never sure of whether it will survive or not, depending on how we receive the puppy. So in our clinic, it's a deposit of 200,000 first before we even take the case on. Otherwise, we don't even try.
Wow.
Question that relates to
the
Prof. Prof, you comment on that. I'm sure you're going to comment on that. Somebody was asking how your center engage with private sector, or do they have a department that is mandated to interact with the private sector? Actually, the question is, do you interact with the private sector for some of your mandates to be fulfilled? And how do you I mean, that's basically the question. Because if your things are not commercially, research are not commercial, the center might not just be contributing to society. So I don't know whether you want to take those questions now.
Exactly. The key thing is that whatever you do, if it's not benefiting the society, is of no use. That's the bottom line. The center is here to give services to the society. The center is here to solve societal problems. So we have been doing societal, how do I say, engagements. The first ones we are doing is trainings. We do basic and advanced trainings in recombinant DNA technology and the rest of this thing, so that our scientists could get the knowledge, because that's where everything is going now. The world is going that way. So that's what we do. First, we educate on the scientists to know that these technologies are here with us, and you can benefit by coming to learn hands-on applications. The second thing is, of course, to give a foundation for what I earlier talked about. Entrepreneurs who want to develop themselves in terms of drugs, biologicals, technology. We have experts who are willing to come, and many of them have given webinars. I think probably we will be advertising more of webinars. We have experts in CRISPR-Cas9 technologies that will come to give us whatever it is that we need. Knock out the genes and the rest of it. We have some people now who are developing biomarkers for diagnosis of diseases in rural communities where you don't have what it takes to run ELISA or PCR or even, what do you call it, a thin blood mount like that. Those biomarkers will be used by clinicians and other scientists in rural areas and other resource-free areas so that you can effectively diagnose your diseases. So things are coming up. We definitely need, and the door is open for, let me not keep calling them entrepreneurs, to key in or cash in to see, yes, these things are here, let me come in and then see what I will do. And I want to encourage that let's not look at it as an individual thing. 3, 4, or 5 of us could come together to develop something. When we come together, we do things. Individually, we may not be able to get to do this, but when we come together, we will be able to do this collectively with our own weights, experiences, and finances. Believe me, it's possible.
Okay, sir.
Yeah,
Thank you
let
very
me
much.
respond. Let me respond to him.
Okay,
And then,
Dr.
when you are investing in non-food animal, you have to be very careful, because the food animal, the way I'll put it right now, are far better in marketability of the products that you use in their value chain than the non-food animal.
True.
Let me just be. I have sold vaccine in this country. A companion animal vaccine, or what you call the pet vaccine, so to say, that only 5% of the volume of food animal. That's we're talking about poultry. So when you are going to be an investor, you have to look at the end of the value chain, at the end of your travel. What are you going to get? Business is not a game of thank you, I beg, please. It's a game of profit.
Definitely.
So when you look at the marketability of your product based on your perceived demand, which will be in your mindset before you go in. You don't just go in and struggle with demand.
I agree with you.
So these are 1 or 2, 3 things. If you're talking about food animal, because once the animal is how many years, you just eat it up, or you eat it, you sell it, you do it, and then you look at your country. Pussycat in Britain, products for pussycat in Britain perform far more than products for dogs in Britain and America.
Yes.
And then if you translate it or juxtapose it with what we have in Nigeria, and you go into a pussycat of a Parvo leukopenia, feline panleukopenia, which is the origin of this Parvo virus. This Parvo virus we are talking is the origin. The origin is feline panleukopenia.
That's right.
And unfortunately, or whatever, interestingly, by the time the thing changed to Parvo, it changed host.
Yes.
From feline to dogs. Anyway, let's move on. So these are little things you consider. There are environments that love dog. The love of dog now in the country, in Nigeria, most now is on security, not on compassion.
What I want to further explain is that when you have the resources for biologicals, it doesn't mean you will stop only at feline or canine vaccine. Right now, the foremost of what we want to develop first is an iron exchange vaccine targeting Pasteurella. It's pretty easy for us to do. And what we are looking at, the beauty is that it may give us what we lack. One of the problems we're having, covering all the strengths. Because many, just like when we were in vet school, the first one we had is the foot and mouth disease that they don't cover all the strains or the 7 strains. You have one vaccine that will cover all the strains. We have to develop something that is cheap and can cover the whole strain. And that's what we are targeting now. So it doesn't mean if you have a company that you can produce a Parvo vaccine, you will not be able to produce IBD or Newcastle disease vaccine or even PPR vaccine. You have your cell line tissue culture thing is stable. And all you need to do is to know what to do. And right now, like I told you, with the genetic manipulation, so many things could be done. You just need an epitope, and then you go and develop this thing, and you have immunogenicity. You try it, it will not take as it used to be. I know you have to go through clinical trials, but I believe is possible.
Well, Prof, I think it's a journey that can start, but how early we can reach the destination is what I don't know. I have one hand raised. I'm
Please
going to
let him
allow
change.
that.
Please, before we allow him, let him change his name. Let him rename himself.
Okay.
We won't be
iPhone
talking to a ghost.
976-819. Please rename. Let's know who we are talking to. But
Yes.
while you are doing that, Prof, what is the place of biosecurity in the management of parvovirus enteritis?
Good.
Biosecurity.
Good.
So biosecurity.
Good morning, Dr. Ibe. This is Dr. Emeka Moneke from UK. I don't know how I can rename this, but I really want to make a comment if I'm allowed. Thank you very much.
Okay. Okay. Don't worry, I'll rename you. Don't worry, I'll rename you.
Yeah.
Okay. Let's Dr. Moneke be renamed. While it's being renamed, we'll do the christening later. Security in the management of parvovirus enteritis.
Biosecurity. You know, biosecurity is the frontline defense against all diseases that you can think of. It cannot be overemphasized. Our biggest problem, when you look back at history, is that we thought the Harmattan wind and dust was the one that was distributing parvovirus around the country, around this environment. Because then you have the incidents just around those cold and Harmattan months. Gradually, we started to get incidences within the rainy season. Well, sure enough, this part of the country where probably before it rains, you get a wind, a storm, whatever. So you think that, okay, that is contributing to the spread of this thing. But then we started getting sporadic cases, even within periods that are not normally Harmattan or rainy. So now that led us to think that, well, probably this thing has just entered the environment and is just waiting for susceptible puppies to infect. Not that you need a vehicle for the transmission or transfer of these things. So since we have this virus in our environment, what do we need to do? I think we should concentrate more on protecting our environments. What I mean by protecting our environments, breeders, they should be very, very serious about the biosecurity. Clinicians should be very, very serious because, you know, once an infected puppy comes in, it will contaminate the environment. So probably it's better for you to have a place where you will be handling only parvo cases and leave other areas to other conditions that are not as contagious and infectious as the parvo thing. So definitely we cannot overemphasize on the need for biosecurity in whatever we do. We need to protect those susceptible ones that are not infected. And it's very difficult with parvo. Some of them, you know, they advocate the use of cages with layers of support before you could get them out of susceptibility. Well, I don't know whether
So you're advocating for an isolation. Yeah.
yes, either
You're
infected,
advocating for an isolation unit.
isolation, yes, either infected
Yes.
or susceptible ones.
Yes.
Both of them will require isolation. Because
And it looks like the disease is not weed-borne.
airborne. It's not airborne, really.
It's not airborne.
It's not airborne. Yes.
There's no report about it
So
being airborne.
in that case, you can run an isolated pen or isolated ward, isolated boarding facility, even within, but the movement of the workers has to be checked.
Has to be checked. And the way they
seriously
monitor all the vulnerable puppies too. Yes.
The moderator discussed this earlier. I had, when I was trying to get this going, I had Olatunji discussing about these movements like that and how cautious and careful you have to be.
Yeah. And then you moved a bit. You were jiffy when you are talking about the type of disinfectant. You know, you didn't hit the nail, so that people.
No, he said sodium hypochlorite.
Yes, he did have. He said hypochlorite. Yes, but you just moved it in passing. You need to emphasize on it.
Right. Okay. I just said that ordinary germicides and disinfectants don't work on this virus.
Yes.
The only one that has shown effectivity is the bleach.
Yeah, chlorine-based.
Yes.
Chlorine-based.
So we can use this one now for now. However, I encourage our scientists to start looking for further things. We cannot just have just one thing that is effective against something and they will fold our arms.
Let me engage you. Let me engage you here, sir.
Yes.
Originally in virology, how do I put it? You know, the assumption is that all the DNA viruses are double-stranded. That was the original. Yes, that's the original assumption. So these are later advances in science, and these are later evolutionary products. Yeah, and if you're dealing with non-enveloped virus, just like in poultry, where I think I can confidently talk, when you're dealing with non-enveloped virus, their disinfection is very rare. But the envelope virus, because of the fragility of the protein covering them, called the envelope in quotes. Once you get them, you naked the virus. You naked the envelope virus, they're dead on arrival.
If you naked the virus.
So the virus, but naked viruses are very difficult. And all the DNA viruses, whether double-stranded or single-stranded, are naked viruses. So if you're really, and we are happy, at least we're happy that in Nigeria, in our country, the bleaching agents are all over the place.
Yes.
There's one they call hypo, you know. So we are not here to advertise it. So what I'm saying here is that such up to in fact in poultry, gomboro, even bleaching agents don't have business with them. It's the iodine based. Anyway, the iodine and the chlorines are in the halogen group. So I think if we really want to look at disinfecting agents, we should go to the halogen products, iodide, bromide, chloride, and fluoride.
Well, I'm glad you are talking this way. We have, that's the good thing of having entrepreneurs. Because once an opportunity is presenting itself, an entrepreneur will use that to develop something, to solve a problem, and then make some money. That's the whole thing about entrepreneurship.
Yeah, that's it. You know, this is an interesting topic. So we are broadening our mind. I think and ideas. I think from the look of the gomboro viruses are double-stranded RNA virus. which are very rare. And all the double strands RNA virus are very difficult, they are naked virus. Now we're having iodine that in the halogen group that deals with them. Now we're having chlorine in the halogen group that deals with feline panleukopenia and parvovirus. I think our thought now is to do research on other, maybe the bromide, the fluoride, which are all in the same halogen group. You know, that's the way we think, you know, scientists think, not traders like me.
Dr. Ibe,
Yes.
Dr. Ibe, I think we should have Dr. Monike to
Monike, please.
talk. Yes.
Monike, sorry, please.
Yeah,
We
the time
forgot
is
about
quite
you.
tense and we are fast losing members of the audience now. So, Dr. Monike, please.
Monike, please. Where is he? Monike.
Hello, Dr. Monike.
Unmute yourself. Unmute yourself.
Yeah. Sorry. Yeah. Good morning or good afternoon, everybody, wherever you're. Sorry, I have to cut in because the talk. I've been moving it around in circles, and I've lost my thought process. My actually area of interest, and which I wanted to ask the prof, is based on the commercialization of what they have found, their research findings that are commercially viable. And I'm also so interested and impressed that their work have shown that maybe the vaccine failure that noticed recently, maybe because of the either genetic shift or drift of the parvovirus from the CPV back to CPV1. So, and like I asked earlier, how can their findings be commercialized? And somehow Dr. Ibe put a damper in it by saying that, you know, if you want to go into partnership or into production in things that have to do with pet animals or non-food animals, that one should be very careful. But I think that the position from where Dr. Ibe is coming is far-fetched because Dr. Ibe maybe is not conversant with what is happening in the industry, in the veterinary industry currently, because he's comparing it with what is happening in the UK and co. But you see, the veterinary industry in Nigeria is growing. It's now going away from the mostly non-food. It's now moving from food animal based to non-food animal based.
Good morning.
Which is something we have to recognize. And also, it is not very good as a country.
Yes.
We play catch up. I think the only
please, mute yourself.
So the only vaccine producing have in Nigeria is NVRI. You find out that most of the vaccines we use in our country imported.
Like a live flyer. Why I ask? People call very generic dogs.
Whoever has to remove themselves. Okay. So thank you. So most of the vaccines we use in the country are imported, especially in pet animal practice. And which is like, actually, if we look at it also, it's what do you call it? It's even a security concern that as a country, we cannot manufacture
I don't have the facility.
So whatever Prof is doing in their sector, I strongly support it. And also, for me, I'm of the opinion that we, the veterinarians, who are stakeholders in this, should come together and rally around them and see how we can commercialize these products, whether it is non-food animal. Because if you look at the trajectory of what has happened in the pet industry, Dr. Tunji Nasiru will equally attest to that. few years ago, you could not have the Small Animal Veterinary Association in Nigeria. But now the Small Animal Veterinary Association is growing and is becoming very strong. It's a big entity on its own. And that industry needs to be supported. And how do you support them? You support them with the materials they need, just like this type of vaccine. You know, so that the clients, the customers, those people who are bringing these dogs, and all those, like Dr. Victor said, a lot of young people are into dog breeding and it's a big industry on its own. Dr. Ibe might not understand that. He might think that most of these dogs now that are being used for security purposes. But you know, with internet, TikTok, Facebook, you find out that there's a lot happening. Even I'm even surprised.
Dr. Manike, please round up.
Yeah. So please, what I want to say is that, Prof, like I said, we need to get your information, your contact, and also find out the way we can visit your office. And some of us that might be interested, see how we can take this in further. This is what I want to do. And this is what I want to
Professor Jahun is now the director of Center for Biotechnology, Ahmadu Bello University.
Okay.
Yes. So
thank you very much, Dr.
He's a small animal clinician, I believe.
This is very encouraging to us to the veterinary.
You know, please, now that the business of vaccination is trying to come on air, I'm interested. I should have my own share. Somebody who mentioned this initially.
Okay, Victor, you are almost.
Let's have a direction. So let's move on. As somebody now, I think Nasir.
Yes.
Are you still bringing out questions, or do I take on from here?
No, you can take the rest, because I think we already passed the hour of 12.
Yes. We passed. You know, we started late.
We started about 20 minutes late.
We are going to stop by 12:20 or 12:30. Permit me, please, to recognize, before I move, some foreigners with us. Dr. Nchang Mbafo from Cameroon, Madeleine Asolefak, and Emma Fumlak. And then I think we have Bonoteko. They are from Cameroon. I think we should call one of them. Dr. Nchang, please unmute yourself and tell us actually your idea from what is happening in Cameroon. Maybe that's the only person we're going to allow. Dr. Nchang.
Yeah.
Nchang Mbafo.
Yes, I am online, Professor.
Professor. Okay, can we have your face?
My network system is not very good, eh?
Okay.
So please.
Let's have your perspectives, please.
Okay.
Can you now have a view of my face?
Yes.
Oh, sure.
Thank you.
Welcome.
You have gap tooth.
Thank you so much for the beautiful presentation. Actually, because of network problems, we didn't start at the beginning. Then I want to say the discussion is very, very beautiful.
Please, if you are not talking, please mute.
Oh.
Charlie, why don't you mute everybody? And then
No. You mute him and he will come back. You mute him, he'll mute himself. He's muted now. Continue.
Continue, ma'am.
Hello, ma'am.
Let her unmute herself.
Unmute yourself from Bafo.
Okay.
Okay, continue.
Greetings to everybody.
Yes,
and I'm glad to be a participant in this forum. Yeah. Actually, I was saying that I didn't start at the beginning because of network difficulties, but where I met you people, in fact, I've really benefited so much from the discussions and even exchange of questions and answers. And I am from the University of Boya, where the veterinary school is just 5 years old. And we will be graduating our first batch in July 2025. So that is when they will attend the 6th year and they'll be preparing for their end of year certificate. So learning all these things that you people have said is very helpful to me because I will use it during clinicals to work with students in our laboratories, and even when they are doing their internship, I'll equally use the information to assist a lot of them. Thank you people very much, and good afternoon.
Can you chat us your number? Give us a chat, your number on the chat.
Okay.
Your
Let
WhatsApp
me now
number.
give you yes, Cameroon WhatsApp number.
Yes, WhatsApp number. Because
Okay,
we want to have a link with your faculty.
Okay.
We want an exchange of ideas from your faculty.
Please, this number we are even using, this WhatsApp number I'm using is my WhatsApp number.
Yes. No, but you came in, you came in from into Zoom. So we don't have the number. We just have your name. But if you can call it, you can call it. But if you can you call the number? You know, we are streaming this. We are streaming this on the.
Since you have a pen, just jot it down.
Okay.
Cameroon code is 237. And then now you start 677.
677.
54. 3865.
3865. Okay.
Yes,
we will engage you later. Eh? And then we send the video. We send the video to you.
Okay.
So that you can pass it around. But another thing is, anyway, I'll discuss with you. Every Saturday we're having hot topics like this. Next Saturday we're going to have we're going to be in poetry on flock uniformity in poetry. So, so we have some technical issues. You know, these things we want to solve, which is costing a lot of money. You know, ideas. Ideas is money. Is that?
Yeah. With the number I've given you, if you just communicate me, I'll get the information.
Okay, no problem. Thank you very much.
Yeah. Thank you so much, and I'm grateful. Have a nice day.
Okay. Great people in Cameroon for us.
They were so Prof.
Yes. Thank you your area was with us in Nigeria some time ago.
Okay.
Yes. Thank you.
Thank you. It's so nice.
Yeah. Okay. Now I think Professor Jahun. Hello, Professor Jahun.
Yes, I can hear you.
Yes. You didn't discuss the age limiting of the parvovirus, the age limiting, and then the cardiomyopathy, and then the graded feeding when you start feeding, because don't just throw in coerced feeding from the one where you start, and then rapid test kits. I think you discussed something about rapid test kits. You discussed about biosecurity. Just in a jiffy, touch on these two things: cardiomyopathy, age limiting, and graded feeding.
Okay.
Once you start feeding. From liquid to less bland to coarse and blah blah.
Yes, certainly. Actually, I went lightly on the cardiomyopathy because it's not very common these days.
Okay.
Usually, since the virus affects the rapidly growing cells, the youngest animals that are susceptible are the ones that were suffering from the cardiac form earlier. And before you know what's happening, an animal is dead with no sign. However, I don't know whether it's the change we are getting or there is a kind of immunity, like a herd immunity that is coming up. I cannot put anything on it, but there are things happening that the myocardial form is rapidly going away. You hardly hear a report of it anyway. And that leads to the age limiting thing. It's not likely that dogs older than 6 months could come down with Parvo. That was an earlier thinking. I'm sure now practitioners or clinicians will tell you that they've attended to Parvo in 6 months and above dogs. I don't know, probably Dr. Nasiru give us, or some other doctors of his own experience of the oldest animal that has suffered from CPE from anybody. But meaning what I'm trying to say is that there is a drift, a shift, like you said, right from the CPV1 to CPV2 now, A3, AC, that we are getting. Because is showing like a shift from what we used to newer things, where this virus now can infect all year round, can infect even older animals, and rather than the younger ones we used to have. After a certain time, then when we see a dog with even hemorrhagic diarrhea, we start of thinking something else, probably Alzheimer's, other hemorrhages causing diarrheic diseases, like sometimes you get that in canine distemper, isosporosis, etc., etc. But now, eventually you diagnose that is parvovirus enteritis. So we've not seen the end of it. And I think we should not let our defenses down that this is it. We should brace ourselves for more things to come. The dieting, like you said, the wisest thing to do, or the recommended thing to do, is you don't start to feed an animal till you don't see diarrhea or vomiting again. That's when you start to introduce oral feeding. Now, even on the oral feeding, like you said, you don't give pedigree chums or any of those dry foods for animal. No. You start with liquid things and see the response. Luckily, an animal that's ready for feeding, you will see it lapping water by itself in most times, because this is a condition that is associated with thirst. And by the time you see the animal drinking and it's not vomiting, and it has not resulted in episodes of diarrhea, then you know that that animal may be ready for a bland diet. So many people start with pap or gruel or things like soft turnaround or something like turn brown or something like that. So gradually, as the animal is getting used to eating this without any response, exaggerated response like vomiting or diarrhea or stomach discomfort. I wanted to talk extensively about the pains in the stomach, because it's something that is associated with pains, not as much as that of GI form of canine distemper, but enough on its own to discourage people from feeding an animal. You know that the animal is ready to start eating. Gradually, it will graduate to eating the normal or its household diet. So definitely it has to be gradual.
Yeah. Nassim, please, do you have anything to say on the age? But you see, maybe if you get more beyond the age of 6 months, it doesn't form statistics, because science is dealing with statistics. So
I have attended to dog who has suffered from parvo at the age of 8 months.
8 months.
10 months. 10 months.
Okay.
And one thing that we have not all said here, and perhaps maybe it was just something we missed, is that there are some dogs that are more
susceptible.
Mm-hmm. These dogs that are black and tan is a phenomenon. Black and tan dogs like Alsatian, Rottweilers, Dobermans. In fact, some of them are genetic non-responders. No matter what you try to do in terms of vaccinating them, they will never take those vaccines. So I tend to shudder when I see a Rottweiler coming down with parvo. Mostly, almost 90-something%, they never survive. And because they are presumed to be genetic non-responders. I don't know whether Prof has had experience about this, that based on the drugs, based on the breed of the dog, you're already counting your losses.
Well,
Yeah.
actually, this has given me something to maybe put a student on it so that we can conduct a study on this, so that we can come up, like Charles said, a data on it. But around here, we don't have many rich people to afford those things. And we don't have many breeders.
There are a lot of them in Lagos, sir. A lot.
Maybe I'll come to Lagos one day there and enjoy cases. Let me see. But however, what I want to say is these are very good observations, and definitely look at them and let's see what we come up with. We may have an interesting result that can revolutionize something. And give
Dr. Mbafo should mute. Dr. Mbafo should mute, please.
I'm trying to.
Go ahead, Prof.
This kind of meeting, one of the importance of this kind of meeting is to give us challenges we that are in the institutions. Let's hear challenges from the field or from other workers, and we get to work on them. That's the benefit of what they call town and gown meeting.
Yeah, we are.
Dr. Ebe, over to you.
Yeah, we have said it several times that like I have gone to MVRI on a seminar as a guest speaker, and my title is "This Business," just like you were just saying. This the business called research. I dwelt a lot on. There are a lot of things we see in the field that has not really formed a norm in research, which is supposed to be looked into. And we see these things almost on a daily basis. So it's just like in the world, in the good research world, the people in the field are supposed to be giving information to the people in research laboratory to look at what they are seeing. In fact, that they have to call doctor. Because in the normal literature in poetry, once you cross 10 weeks, it's like the birds will not get gomboro again. I mean, while we've seen in the field, we've seen it, but not rarely. We've seen it in 18-week, 20-week-old birds. And we came with pictures, with slides to flash at them. And something must have been causing it. What is causing it? Is it that the person is not regression or what? But one thing I found out just like we said, one thing I found out in Parvo is that the Parvo multiplies with the speed through which the gastrointestinal tract are multiplying. And when they multiply, they get to a stage, they stop multiplying. At that stage, they stop multiplying, Parvo stop growing. I think that is why I believe strongly, that is why it is age limiting, because it works with the multiplication of the cells in the gastrointestinal, in the intestinal tract, not even gastrointestinal tract. And once those cells stop multiplying, at the end of their development, the Parvo does not multiply again because the environment to multiply is no more there. Whatever is causing it, I mean, I do not know. That's all I can say about it. Thank you very much. I repeat again, Professor Jahun, you're a teacher. There's no doubt about it. We're going to call you back again. You say once a food is sweet, you don't eat it only once. You will come back. Just like me and Nasir. Once we enter Lagos, he doesn't even ask me what I eat. He will just take me to Begri joint because he knows that Begri, I love Begri. So I love Begri. And Professor Jahun, we are bringing you back here again and again. And just like I told Dr. Professor Mbafo, next weekend we are dealing with flock uniformity. Flock uniformity in poultry production. Because if you don't have a flock uniformity, you see birds who are not, they're genetically almost same, and some will eat and struggle to be more than the others that attain target weight production in time, others will not. So you see some very small, some very big. The target weight has to be uniform. That's what we're going to discuss next week. The upper week, we are bringing Professor Tomori, hopefully. We are bringing Professor Tomori to come and to discuss monkeypox. So you can see that we have lined up programs. And then, yes, the next week, we are bringing, who again? We are bringing Professor Mobo.
Dr. Dotun.
Yes. No, Dotun is on 21st. He has changed.
Okay.
Yeah, he has changed on 21st. So we are bringing somebody, but we are bringing Omobowale. Yeah, thank you, Professor Omobowale on 14th to come and discuss canine heliciosis, and we are bringing him again to come and maybe in October to discuss leptospirosis. So as many topics as possible because of Bluebird TV. And then when we started, like we discussed. The first time we discussed with the executive director of National Veterinary Research Institute Forum, we spoke vehemently against production of live vaccines and then warned against it. And then because it's a real issue in terms of epidemiology of rabies virus. But after that first discussion with her, the second discussion with her, they have stopped production of live rabies vaccine. So you can see that we are working and we are working.
Let me ask this question. The last time I heard, they were trying to see how they could kill the virus in the process of getting the vaccine.
Yeah, I think they have succeeded. They succeeded.
And
yes.
They are producing.
Yes. Even Nasir has used it. And the dogs, because once you have live vaccine inside the dog, rabies virus, and you carry that dog to any international airport, once they check it and it has live virus, they'll kill that dog. They'll collect it from you. And then Nasir has said that he has a client that has taken his dog outside and has vaccinated with the rabies vaccines from VOM, and he has not, that they didn't kill it, which they have succeeded, actually. They've succeeded. So, and the woman, Mrs. Mariam, Dr. Mariam Mohammed, actually confirmed it in that discussion. So we are bringing people for updates. We are going to bring Dr. Segbe, who has just gotten his second tenure DG of quarantine. Yes, we are bringing it. We have a lot of classic people we are bringing on top of here. And one day we'll bring Professor Mbafo from Cameroon to come and discuss. We are bringing Ntoya from Kenya to come and tell us how they got the veterinary directorate that is regulating and registering veterinary products under Ministry of Agriculture. You know, there are a lot of topics we are generating. We are not sleeping. But be it as it may, please, if we are going to circulate this video in the YouTube, help us to subscribe. Click the subscribe button, notification button, so that the algorithm will make our product line, our discussion to go viral. We are going to say all the platforms, as many platforms as possible. And as you are watching, so please, you only subscribe once. You won't subscribe again. And we are moving, and we'll move. Thank you, Jahun. Let me give you your own time. Oh God.
Let me thank
you. Eugene, you are coming late. I don't think we have time. So, Dr. Nchang Bafo, we will put you on hot seat here to come and discuss with us one day. Are you hearing me? We'll give you a topic, and you are going to line up discussants from your faculty, because you see, the world is going global. It's a global village. We need to know what's happening outside the shores of our land, outside our territory, and we are in the same climate, and we're in rabies. We're in the same climate, the canid climate. So there's no separation. Your area in Cameroon was part of us till 1961, when they had the what do you call it, and the plebiscites, and they left Nigeria. There was one Cameroonian, I've just forgotten his name. He was a minister in Tafawa Balewa's regime. So it's from, I think it's from, what's this part of Cameroon? Anyway, whatever be the case, so we're all together in this business. So that as we are learning from you, you are learning from us. You can't carry our learning and run away. The same thing we are doing with Ghanaians, Cameroonians, Liberians. We are trying to form a team. And Eugene, you did not, when you're supposed to raise your hand long ago, maybe next time. Oh, because we are coming to the end of this. Thank you, everybody. God bless you all as you leave us. I believe we have learned a lot. Prof, if you have a word, just a small word, through so we can go.
Just to thank you and Dr. Nasir too, and others. And I want to say that this is apt for you. I keep on saying that there is a division, just like you confirmed too, between the town and gown. The institution and researchers are just there working. Meanwhile, the field or the industry is on its own working. It's time to come together. And what you are doing is really bringing the field into the labs for us to have a discussion about what our progress will be. But most importantly is that let something come out of this. Let's not just be talking, let's have products that will come out of these things that you are doing. Let's develop markets, entrepreneurs, let's make money. Let's make veterinary profession a robust one due to these things we are doing. That's just what I want to say. Thank you so much.
Thank you. And finally, my commitment by next year, we are thinking about coming back to vaccines again on canine vaccine. Now, Moneke is telling me the business is doing well in the canine industry. I think it's whetting my appetite. By next year, we are coming back actually with vaccines. The type of vaccines we used to have before, and there was no problem. I think part of our problem is that, some of these vaccines, some of them are maybe in the process of processing the vaccines, they were not processed well. Instead of being immunogenic, some of them are pathogenic. You inject the vaccine within 1 week, the dogs are done, the puppies are done.
That's what we were thinking.
Have you noticed it?
You could come across the C part of CV2. We were just thinking that shouldn't even be in the country.
Yes. So you can see that that's a problem, and we are being flooded by all manner.
Can I say something before we round up on that thing you have just said?
Yes.
See, Prof, and then Dr. Ibe, what me have noticed is that we do not ascertain the immune status, or let me say how healthy those puppies we want to vaccinate are before we vaccinate them. A lot of dogs, a lot of puppies are already incubating problems. And then we will not do a basic clinical examination, we will not do basic diagnostics, and before we know, we just go and vaccinate, and then we render that stress to those puppies, and they come down with Parvo. So our vets actually making sure that the environment they are introducing the vaccines into is a very good environment. Because I've seen that as a problem. A dog that is already having a lot of warm body, a lot of nutritional problem and everything, and you're going to vaccinate that puppy, it will come down. That's what I think.
So you are advising people to have rapid test kits before they can vaccinate, and then evaluate ceremony.
Evaluate very well.
Clinical environment first, very well.
But when you have a vaccine by a manufacturer, and in that environment, there is a vaccine from another manufacturer, whether it's working or it's not working, not giving you the same problem the other one is giving you, you start thinking, we are scientists, the way we are trained. And I think one thing about veterinary medicine, what veterinary medicine taught me is that you think ahead of time. As things are rolling up, your head is working very fast. And that's why we can accommodate many breed, many strengths of animal into their medicine, into our head, unlike the human medicine. And your patient is not talking to you. That means body languages, a lot of things you're reading. Before you know it, your heads are working. Before you nail the diagnosis. And in fact, even before you nail the final diagnosis, the preliminary diagnoses are there in front of you. That at the end of the day, It's whatever you're doing next is just like it's like I don't know. It's so what I'm trying to say is this: is that a lot of things are happening in the field, and we're picking up 1, 2, 3, 4, 5. But yes, you're right. You know, and you're right. There's no doubt about it. The vaccinating animal that is already stressed with an infection is not that good. It's a companion animal. No, in poultry, we'll be getting that it might be very good, it might be better. But in a companion animal, is more especially puppies. And puppies are very delicate at that age or below 6 months. One has to be careful in management of those diseases. Thank you very much. I think at this age, we call it a day to reconvene next week?
Yes, so
Yeah.
we have spent about 2 hours.
Yes. Thank you. Thank you very much. Professor Mbafo, thank you all. I'll chat with you later. Thank you.
Thank you all and goodbye.
And goodbye.
Thank you, Prof. Wow.
Yeah. Goodbye.
Bye.